Good evening for everybody. My name is Kristina Golovchinyr, and I'm a doTERRA Israel product specialist. And so today we will talk about how we can help with our products, with our essential oils in the light of the current situation. So how to cope with emotional difficulties and fears in light of the current situation. So, and what is the current situation? War of the Iron Swords. This is a war between the State of Israel and terrorist organizations in the Gaza Strip led by Hamas, which broke out on the morning of Saturday, Simchat Torah, October 7th, 2023. And what does it mean for us? Just a moment, I want to hear. So you see it. Okay. So, and what does it mean even if we pronounce this word war, so we already have certain reactions, of course. And what does this situation means from the point of view of our physiological, mental, and emotional state? So we now in this acute stress disorder. So we need to understand that we in this situation. And what does it mean? It means that this acute stress disorder requires the exposure to actual conflict and death, a serious injury or sexual violation by other directly experiencing it, witnessing it in person, learning it occurred to a close family or friend, or experiencing repeated exposure to or a variety of details or traumatic event. So, and psychological trauma, mental trauma, or psychotrauma. So, this is emotional response caused by severe distressing events that are outside the normal range of human experiences, such as violence, rape, or terrorist attack. And the event must be understood by the affected person as directly threatening an affected person or the loved ones with death, severe bodily injury, or sexual violence. Indirect exposure, such as from watching television news, may be extremely distressing and can produce stress response, but doesn't produce trauma by itself. And related concepts to traumatic experiences and the impact on personality. Mental trauma. Secondary trauma is trauma inflicted on those who care for trauma survivors, such as social workers or first care responders. And here I want to say that if you need help, so please use a professionalist. And because in such condition, you need especially at the professional care, professional help. And if you want to help people that now experiencing this psychological trauma, you need to be very careful because you need to evaluate your strength, your mental, your emotional strength, just to deal with people that experience this very traumatic trauma. Because you can deal with some such unexpected situation and even aggression. So because they stay in a very traumatic situation. So be careful. And I know that many people today want to help people that experiencing this situation, but as I told, you need to evaluate your strength to do this. Okay. Now, acute stress disorder, an anxiety victim is a person who inhibits acute signs of anxiety immediately after a traumatic event. This is not a medical diagnosis, but a general concept common in Israel. Acute stress disorder is a mental disorder that occurs as a result of exposure to a traumatic stressor and lasts less than 4 weeks. So we now in this acute stress disorder, and post-traumatic stress disorder is a mental disorder that lasts more than 4 weeks. So I see that our task today not to develop this post-traumatic stress disorder, not me and you and all your family and friends, we need to do maximum just not to develop this post-traumatic stress disorder. And complex post-traumatic stress disorder is a type of PTSD that is triggered by more extreme events and causes more extreme consequences. Adaptive disorder is a group of mental disorders that occur after stressful but not threatening events. Now, please pay attention that women are at high risk of developing this disorder. And what is very important to understand that not everyone who develops acute stress disorder eventually develops PTSD. And about 10% of Israelis suffer from post-traumatic stress disorder caused by war and other causes. So please, I want to draw your attention that 10% of Israeli just suffers from this post-traumatic event, but you understand that after war, there will be more people, and so that is in our society, there is a constant disturbing background. So it is very important to understand. Now, of course, that this acute stress disorder, we can experience some behavioral symptoms. So sleep disturbances, eating disorders, and you know that today it's for 100,000 people in Israel suffer from eating disorders or variety degrees. Irritable behavior and tantrums. This usually manifests itself as verbal or physical aggression towards people or objects. Hypervigilance, difficulty with concentration, negative mood, a persistent inability to experience positive emotions, and excessive panic reactions. I believe that now you feel that we really stay in some this hyper-nervous situation, and people can experience such behavior. So just be careful, you, and just to know that it can be. So, and according to the Hans Selye, that we called him the father of stress, it called general adaptation syndrome. And you know that in this syndrome, we have 3 stages. First, it's alarm reaction, and you know this alarm reaction as a fight or flight response, yes? And another stage, second stage, it's resistance stage. So in this stage, body tries to repair itself after the initial shock of stress. And if the stressful situation is no longer present and you can overcome the stress, your heart rate and blood pressure will start to return to restless levels during this stage. But if you continue to be in such a stress, so your body continue to secrete these stress hormones. And the third stage, exhaustion stage, that so just you have not enough not enough energy to overcome the stress, and physical effects of prolonged stress can weaken your immune system and increase your risk of heart disease, high blood pressure, diabetes, and other chronic health conditions, including mental health disorders such as depression or anxiety. And so our task is just not to develop this exhaustion stage. So I believe, I feel that we now stay in this first stage, and maybe we now on the 9th day of this war, maybe somebody of us just on the second stage, but this stage is also some people can feel some feelings to overcome the stress, and others still in this acute stress. So we need to understand that it can last 4 weeks, and after that many of us will be in a post-trauma. And once more, I hope, I believe that with essential oils, with this technique that I will tell you so we can overcome this stress, to cope with stress, and not to be in post-trauma situations. So in the situation fight or flight, natural emotions for survival, they're very natural. Okay, so it's anxiety, fear, loss of control. It means run, flight. And if you feel anger, rage, so it means fight. Okay, from an evolutionary point of view, we're accustomed to the negative emotions that have accompanied humanity for thousands of years in a struggle for survival. And emotions that oppose survival, the feelings of resentment and guilt. And pay attention, please, that guilt is the most unproductive feeling from an evolutionary point of view. So just we need to avoid these feelings. Now, when I preparing this lecture, of course, I wanted to talk with you about all our essential oils and products that we can help ourselves. But at the same time, I need some technique that I can use it together with essential oils. And I have a friend, she's a children's psychologist, and she told me that when she is dealing with her patients. Sometimes she uses this technique, which is called in Hebrew ashandak. And I started to read about this technique. And and in internet, I found that we have a very interesting institute center, which is called Center for Resilience. And here you see the reference to this center, and you can enter and you can read more. And Professor Danny Hamel, he's a clinical physiologist, and he's describing this technique, which is very, very simple. And as you see, I wrote that he's the head of the Cognitive Behavioral Unit in the Tel Aviv University Mental Health Center, and is the director of the Unit for School Interventions at the Cohen Harris Center for Resilience. So I know that many of you know and can read and understand Hebrew. So just we providing this lecture in English, but just to understand what does it mean, ashandak. So please see. So there are abbreviation of the letters. Ein the tzor, stop, shin the shririm, muscles, neshima the breath, and dak the dalit, the burpnimi, and kuf the kadima. Okay. So, and when I prepared the webinar in Hebrew, it was very easy to use, of course, of this abbreviation. When I provided this webinar in Russian, I also had to find something that it will be more easy to understand for the Russian distributors. So I decided suddenly to use the word smile. So please see how we can use this word in this word in this situation. So stop, the stop, muscle, the muscle, inhale, a language. Actually, it is self-talk, but it fits better with L, just to receive this word smile, and enter. Just with this technique, we can enter, we can start our day. And now we will talk. Okay, now I want to talk about this technique, and after that I will explain you how we can connect essential oils to this technique. So what does it mean stop? So I need to understand that this situation, that this unbalanced emotional situation, it's doing bad for me. So it's not good for me. And I need to to say to myself, stop, I will not continue to think about things that they severe frustration, anger. I will stop. I will stop watching TV. You know, many people today have this obsession behavior of watching TV, conversations, internet. So I need to say stop to this situation. Okay, this is first of all. After that, I can start this um, experience with my muscles. But please pay attention. What is important here? So, how you can do this? First of all, according to Professor Daniel, you can clench your fists in this way and unclench them. Clench and unclench. Why? Because Professor Daniel told that if you will ask the person that which is staying in this terrible traumatic situation to relax your muscles, it will be very difficult for him. But during this exercise, okay, it will be easier for him just to clench and after that to unclench. Okay. And but I found another technique. What can you do? You can put, just a moment, you just can put your hands in this way and just to do this. Okay. Why we are doing this? Or you can press your hands and your neck and shoulders. But you see, I'm pressing a small or right, a small or right. Why? Because in this situation, we can connect between a left and right hemisphere of our brain. And you know that a left hemisphere is responsible for logic, and right hemisphere of our brain is responsible for emotions. So on this way, by this physical exercise, we can connect between these two hemispheres, and maybe this will help us to solve the problem or just stop this very negative emotion. Okay, now inhale. This is a technique how we need to inhale, actually to breathe, but inhale is very important here. So you place your hands on the stomach and inhale through your nose. And when you feel that your lungs are full, you need another additional small breath. And after that, you exhale through your nose. So it looks like as okay. And you need to do this. It will be very good if you will do it for 5 minutes. And you can help yourself just to do this exercise. Okay, so with the forefinger of your right hand, you just do this thing though. Inhale, exhale, inhale, exhale. Okay, so okay, and so what we do when you're breathing such way? Very interesting. We trick our brain. As I already have said, that the first stage of danger. So in the first stage of danger, this fight or flight, our sympathetic system is turned on. And during this fight or flight reaction, so our breathing is shallow, rapid, unproductive. And besides of this unproductive breathing, not enough oxygen enters in our brain, and this makes us weak. It causes brain fog. And when we begin to breathe in this calm and deep way, our brain just start to think. Just a moment. If if we breathe so slow and so calm, maybe this situation is not so dangerous. Maybe this person don't need to fight or flight. So just slowly, our brain start to work in the situation that it's not stressful situation. So this stage we can call to trick your brain. Now, so this is the first abbreviation, ASHAN. Yeah, and in our it is SMI. And now I want to tell you which essential oils you can use in this stage. So when you say to yourself, stop, you can use your palms, okay? It's just this physical movement. Why? Will strengthen you. So what essential oils you can use? I suggest to use dominant and bright oils such as eucalyptus that also will help you to breathe more deeply, peppermint, lemon. We call them cold oils, okay? Because this dominant aroma will take you from this place to the world of aromas, of the smells. You can use rose. She can do it. This oil can also be very dominant, and just not forget to apply essential oils to the bifurcation area of the carotid arteries. And you can use warm oils as clove, cinnamon, or blend on guard. Why? Because this is the source of memories of home, sweet balanced pastries that can also take us from this acute stress situation to the very calm situation. Wild orange and grapefruit oils can be combined with warm oils and just to do this effect. Patchouli, if you like the smell of patchouli, it can be very useful here. It's a symbol of paternal protection. And clary sage, combined with frankincense, citrus, and clove oils, gives a feeling of reality with hope to go forward. Now, what oils we can use more? For example, lavender oil. You know that this oil is very calm down our anxiety, our feelings. But lavender essential oil can help balance areas of excitement. And a good combination with wild orange and lemon. Lemon gives mental sobriety and will not allow fear to take over the mind. Rosemary will help remove the fog in your brain and help you to concentrate. Ylang ylang can help bring us back into a state of balance, help us concentrate, support mental function. Sorry. Our emotional digestion is disturbed. So what we feel, it's called emotional indigestion. So in this case, I recommend to use essential oils, spices, okay, such as cardamom, ginger, fennel. Fennel is very good oil because it can help cope with fears. Cilantro, coriander, actually digest them. Now, and for release your muscles, of course, you can use Deep Blue, Aromatouch, Copaiba, and Deep Blue Stick. Now, when we are talking about L, language, or actually it's self-talking imagination, I want to tell you about this outstanding person. Maybe you just heard about him. Viktor Emil Frankl was an Austrian physiatrist and Holocaust survivor. And he wrote a very famous book, which is called Man's Search for Meaning. And when he described his experience as a prisoner in Nazi concentration camps during Second World War. And so what he suggests, so what he's describing in this book. So what was to be done in this terrible situation? We had to awaken the will to live, to continue existing, to survive imprisonment. But in each case, the courage of life or awareness with life depended solely on whether the person had faith in the meaning of life, in his life. And imagination, just see how he described this. I remember how one morning I walked from the camp, no longer able to endure hunger, cold, and pain in my foot, swollen, frostbitten, and festering. My situation seemed hopeless to me. Then I imagined myself standing at the lectern in a large, beautiful, warm, and bright lecture hall in front of an interested audience. I was giving a lecture on a group physiotherapeutic experiences in a concentration camp and talking about everything that I had gone through. Believe me, at that moment, I could not hope that the day would come when I would actually have the opportunity to give such a lecture. So, what is the imagination? And so, what can you do in this case? So, you can prepare some sentences in advance. You can write them, and so it's called copywriting. It's another technique that can help in this situation. And so these sentences will be very simple. I know everything will be fine. I know I have an angel who protects me and my children. I can handle it. I will send positive energy and think only positive. And so Professor Danny Hammer suggests some of these sentences is that he's sure that it's very has a very strong effect to our mind. So I think my life is ruined, and the mind searches for a logical explanation, but it doesn't find it. But I won't let my mind control me, and I accept the pain. But I focus on the important things in my life: family, friends, people I can help, and who can help. And Viktor Emil Frankl wrote in his book, everything can be taken away from us except our values and virtues, love, giving, mutual assistance. So, and our task is to strengthen these values, our very important values. And we say yes to life no matter what. And one more interesting thing that it's very important to pronounce these sentences with a straight back. I even put a picture that you need to be in this posture because it's very interesting, but it's known that a straight back helps improve the functioning of all systems and especially hormone system. And in this stage of this technique, you can use all oils that you love, of course, and so you can use adaptive balance. They can be very useful here, emotional aromatherapy, of course. And the last stage of this technique, so enter to the new day, enter to the life. So to enter to your routine, and because the routine that people doing every day, they start this day with this routine. It's very important. So it's what keeps us in this life, our routine habits. And so for this stage of enter, you can use all these oils that you see, and you can organize yourself this box, key holder, and you can put all the oils that you love, that you're using, that can help you in this situation, and of course take it with yourself. And you can use in this situation the aromatherapy, the emotional aromatherapy kit. And another people who maybe will need the oils that can calm down. Okay, for example, women, and I suggest in this case to use the touch oils in the form touch, what we call magnolia touch, rose touch, jasmine touch. they already diluted and diluted, and you can use them as perfume, and they do this calm effect very, very effectively. And I personally love very much magnolia. And to my grandson, I use when I'm using this massage on the feet. And my daughter-in-law liked very much rose and magnolia, so I see very good effect when I'm using these oils. My family using these oils. And just I want to remind you that in one of my webinars, I told about this woman, that she's a doctor of clinical psychology, and she wrote a book how to use essential oils in her practice. She even did a doctorate of researching essential oils and the brain. And so in one of the meetings, in one of the meetings, yes, congresses. So she gave the list of these essential oils conventions. I forgot the word conventions. And in one of the conventions, she gave this list of essential oils that can help produce GABA. And GABA, this is important neurotransmitter widely distributed in the central nervous system. And so you see this is citrus oils, lavender, copaiba, bergamot, cardamom, and how to use just to diffuse them, to inhale from your palms, and you can do massage with these oils, with the basic oils, with the fractionated coconut oil. And I just want to remind you that copaiba, it's oil that can be very useful in this situation, thanks to the chemical component which is called beta-caryophyllene. And you see that in 1 drop of essential oil copaiba, 45 milligram of beta-caryophyllene, and see the effects of beta-caryophyllene. Reduce comfort only 5 milligram, improved mood 50 milligrams, so just one drop. Reducing sadness and anxiety, it's 100 milligrams, so it's two drops. So you see how you can effectively help yourself with this oil. And just I want to say you that you can always call me, write me, we can even to provide consultation and telephone, and you come to our office. So Sunday, Tuesday, and Thursday from 10 a.m. to 2 p.m. So we can meet in our office. Meanwhile, the situation allows us to do this, so you can write me to email and to the phone, and of course, together we will win. Thank you very much. Stay safe, and I hope very much that this technique will help you. Thank you.